Canines are the longest teeth in the human mouth and have a number of important roles in speaking, eating, giving the lip structure, and guiding occlusion. Let's take a look at some of the key features of the maxillary canine. The maxillary canine has 5 aspects to it: the labial, lingual, mesodistal, and incisal aspects. The one currently shown is the labial aspect. As we can see, the surface is smooth except for shallow developmental grooves dividing the 3 labial lobes. The middle labial lobe is larger, producing a labial ridge. The mesial and distal outlines are concave, convex, and then concave again. The distal cusp slope is longer and more rounded than the mesial cusp slope. The root appears slender from the labial aspect when compared to the bulk of the crown and has a bluntly pointed apex, which tends to curve distally. Let's now take a look at the lingual aspect. The crown and root appear narrower than labially. There is a large prominent cingulum, under which are definite ridges separated by shallow developmental grooves, with strongly developed marginal ridges on either side. In most canines, however, you will find a well-developed lingual ridge with mesial and distal lingual fossae on either side. On the mesial aspect, we tend to see a greater labiolingual measurement than any of the other anterior teeth. The outline is wedge-shaped, with the point being represented by the cusp tip. The cervical line exhibits convexity towards the cusp tip. The root has a developmental depression that helps anchor the tooth and prevent rotation or displacement. The distal aspect is very similar to the mesial aspect, except that the cervical line exhibits less curvature towards the cusp ridge, and the distal marginal ridge appears heavier, more irregular, and is above the contact area. The developmental depression on the root is also more pronounced. Finally, if we take a look at the incisal aspect, it gives a greater idea of the proportions of the tooth. The labiolingual dimension is greater than the mesiodistal one. The cusp tip appears more inclined labially and mesially. That was everything about maxillary canines. If you have any further questions, please comment down below. Thanks for watching and stay tuned for more videos by Ziauddin University BDS tutorials.